let me go through my disclaimer before I get into our topic. Anything that I say tonight during this Wellness Wednesday is just health information and is not specific health advice. Don't start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do so, please first consult with your prescribing practitioner so that they can help you make the appropriate adjustments safely. And attending this Wellness Wednesday does not establish a doctor-patient relationship. So there we go. Okay, ladies, before we dive in to tonight's topic, I want to talk to you for a couple minutes about something I'm so excited about doing. Let me try to get my words out today. Now, I've been talking about this all week, and I want to make sure you understand exactly what it is. I know many of you have been with me for a while, so you know I do a 3-day masterclass, Fix Your Thyroid Masterclass. But this is not that, okay? Many of you have said you wish that I could do maybe like a Cliff Notes version of the class, one that doesn't take 3 evenings to attend, where I give you the direct points that make the biggest difference in you being able to turn your symptoms and thyroid dysfunction around. So I created a shortened version of the masterclass that I call the Fix Your Thyroid Bootcamp. Because here's the thing. I know your life's busy, and I know that even when you register for one of my classes with the best of intentions, life happens, something comes up, and 3 nights, well, it can be a big ask for some of you. So instead, I took the most important, most life-changing lessons from years of teaching, excuse me, and I condensed it all into one focused 90-minute webinar. Without the fluff, without the filler, just what I believe every single one of you needs to hear. And actually, what I'm about to teach you tonight ties directly into it too. Because tonight, we're talking about comprehensive testing. I'm going to walk you through the actual labs that you'll need, not the 1 or 2 your doctor probably ran. And I'm going to show you how to read the labs, read and analyze them correctly, so you can finally explain, why you have symptoms. And so essentially, we're digging out those root causes. Because what almost nobody talks about, and I really need you to hear this, the most dangerous thing that can happen to a woman with thyroid symptoms isn't a wrong diagnosis. In fact, it's getting diagnosed at all. Yeah, I just said that. Because the moment hypothyroidism goes into your chart, your doctor stops looking for answers then. And then from then on, every single visit is about one number. Is your TSH in range? Right? Great. See you in 6 months. If it's not, they adjust the dose, right? And nobody ever asks, why is your thyroid struggling in the first place? I had a woman come to me just this week. Her doctor told her she was pretty healthy. And when we ran a full comprehensive workup on her, the exact kind of labs I'm going to show you tonight, okay, we found undiagnosed Hashimoto's that had probably been attacking her thyroid for decades. We found significant insulin resistance. We found a chronic infection her body had been silently fighting probably for years, and parasites and mold toxicity. Ladies, this is not a rare case. This is what I see all day, every day. And it's exactly why so many of you are still stuck, even though you've done everything right. Tonight is where I do that deep dive with you, the actual labs and exactly what they mean for you. But here's here's a bigger piece you need to understand and exactly why the boot camp exists. That's where I lay out exactly why you've been under-tested and underdiagnosed for years. Why even getting a diagnosis can stop the investigation instead of helping it. And where I'll show you exactly how to actually get this kind of comprehensive testing done for yourself. Okay, because nothing changes until you actually know what's wrong. Not another supplement, not another diet. You have to know. Now, the boot camp is this Saturday, August 15th at 12 p.m. Mountain Time, 11 p.m. Pacific, 1 p.m. Central, and 2 p.m. Eastern Time. Now, this is really important. This webinar happens only inside Zoom. It's not going to be here in the Facebook group. Okay, so you do need to register, and that way you'll get the link. You do not need to have Zoom to attend, but you do need to register for the link. The link to register is going to be in the comments, okay, here tonight. And if you run into any trouble registering, just click on Juliana's name and send her a direct message or text her directly. Sorry. Text her directly at 208-842-4466 and she'll personally get you registered. Okay, now for tonight's discussion on comprehensive testing. First, you need to have a little bit of understanding what I'm looking for when I review these tests that we do. Okay, some of you who have been in this group a while, you have this background. Those of you who are new to the group need to have this background to be able to understand why I'm going through these tests the way I do. Looking at the markers with different ranges and so forth. Okay, they're too wide. The statistical ranges that you see in your tests all the time are exactly that, statistical. They're averages. Okay, and who gets tested? Well, people that have chronic disease, mostly people that are sick. A lot of people who are in the hospital, they get these tests done. They're sick. So this is what I call a sick average. All right. So we need to have a more narrowed range that best represents what's actually healthy and functional. Okay. So I call that the optimal range. And I'll refer to that tonight as I go through these tests. Now, something you may have heard me say a lot is that you still have the power to heal. Your body was born to heal and is a self-healing organism. Many of you may say, however, that you've been feeling this way for so many years, maybe even decades, and you're giving up hope and you're losing faith that you could ever heal, losing that intuition that you still have the power to heal. But your body does indeed have the power to heal, and you have to know that when there are imbalances in your body gives you symptoms. So that you know something is not right. This is how it communicates something's wrong to you. And I know so many of you have been brushed off from time to time, or maybe every time, by your healthcare practitioners. You've gone to your doctors with symptoms and they say, oh, it's just your age, or oh, you're a mom, or of course this is going to happen. You're in menopause. Of course you feel like that. You're tired. You can't lose weight. You have mood swings. Of course you do. You have low thyroid, right? You've been given that diagnosis and now everything's your thyroid. You're always going to have that. And that's when you get told, that's what you get told over and over. And that doesn't fly. And so you start to lose that hope though, and understand, that hope and understanding that your body can heal. And you start to feel like something is maybe wrong, with you, mentally. You start to feel like nobody understands what you're dealing with. But you have to remember, because you already knew your body can heal. But if we give in and ignore the symptoms that your, body's giving you, and they're not being addressed, they turn into diseases over time. And so the way I approach patients or any person who has symptoms or a disease process is to ask the question, why? What's causing it? Where is it coming from? What's keeping this person from getting better? And we have to really go deep to understand the root cause of why someone has a symptom or a disease process. And I know that's that that's kind of like a novel idea. But we think, well, isn't that how traditional medicine works? And it actually really isn't. In traditional medicine, it's just about treating the symptoms or disease, right? It's a disease and drug therapy model. So it's always about, hey, let's find the name of the disease. And when we have a name for the disease, many times it doesn't even tell us what the disease is or especially what's causing it. It's just a creative name for a symptom or a group of symptoms. For example, let's take arthritis. It's a name for a collection of a few symptoms, including joint pain, inflammation, swelling in the joints, maybe deformities, inflammation, rubor, all right, redness. But they just group those symptoms together and they give it a name of arthritis, right? So this begs the question, why do you have arthritis? What do we need to do to get rid of the arthritis? What's causing it? So the name doesn't tell us any of those things. The traditional approach to arthritis may be, like pain medications, like anti-inflammatory pills or creams or, other pain relievers, immune modulators or biologics, we call them. If there's like autoimmune, maybe they did do some tests and they find that it's autoimmune. That still doesn't tell us what's causing it. Even antibiotics like methotrexate or nerve modulators like gabapentin, right? Rarely do practitioners recommend lifestyle and self-care like yoga or walking or a change to a healthy diet. Okay. But if you approach this from a drug therapy model, you have the name of the disease, which equals this or that medication. And everybody that has that disease pretty much gets the same medication or treatment. And those medications are not intended, nor are they able to reverse a disease process. They're mainly intended to reduce or cover up the symptoms. It's not addressing the true root cause or causes. And that's where we get into trouble. Because when you don't address the underlying root causes, that gets bigger and it grows into actual disease, which may be unrelated to arthritis, like heart or kidney or liver disease or even cancers. So for me, I've got to say, all right, why do you have these symptoms? What are the underlying imbalances and what do we need to do to address and reverse these symptoms and these issues? And when you approach it like that, then most of the time the body can heal and the symptoms go away. And your body starts telling you, right? This little voice gets louder and louder till it starts screaming at you like, hey girl, you got to figure this out because I'm tired and I can't function fully. I can't function like this. And I'm not happy. And neither are you. So you have to keep asking the question, why do you have these symptoms? Okay. The body can heal itself, okay? But we need to understand what's driving it toward, that dysfunction and what we need to do to gently push the body backward toward healing, right? Okay. So you really need to understand what's going on underneath the surface. Otherwise, you've got to change your environment, right? That your body's in so that you can heal. And tonight I'm going to go over the typical blood work that I do when I evaluate whether I can accept somebody as a patient. Now, we do other tests that also help our clinical team understand even more, but we don't have time to go over all those tests tonight. But I do want you to think about a couple of things. Number one, have you had all these tests? Number two, and hopefully you have some tests with you tonight. If you don't worry, but you might be able to kind of think of some you've had in the past. Do you have symptoms? Okay. Number two, do you have symptoms? And we've got to dig deeper to figure out where these symptoms are coming from. And I want you to understand that if you have symptoms or you have a disease process that you've been struggling with for many years, and you haven't had these tests done, and you haven't had them analyzed from a functional medicine perspective, then there is still hope, okay? So many of you start to lose this hope, all right, because you go from one doctor to another, expecting a different result from going to the same type of doctor. But all those doctors have the same tools in their toolboxes. They all have the same medications that's supposed to help you. And if it doesn't, as is so often the case, you've got to look for a different solution. And when you look for a different solution and you decide to go down a different path, right? Then you get different information and you can expect different results. Okay, so let's get into this. I'll share my screen and we're going to start here and give a little bit of background on this particular patient that I accepted this week. And she's a 74-year-old female. And this is her comprehensive blood work that she had with me. And some of her history was she had developed a stomach ulcer and severe anemia that left her bedbound for a couple weeks at least, and super fatigued, right? Terrible inflammation issues she was dealing with, significant fatigue now, poor stamina and shortness of breath with just a short 5-minute walk, obesity with weight loss resistance. She could maybe walk to the store, but had to use an electric cart to get herself around in the store to shop. Dealt with back pain and major stiffness and joint pains, knee pains, dry skin, hair loss, pain that disturbed her sleep as well. Let's see, some brain fog, lightheadedness. We're all feeling, things that were these are all her main things that she was dealing with. A lot of things. So she didn't know she has Hashimoto's. All right. So this is an immune system disease. Let me pop down there. She was positive for these antibodies. 22, right here, thyroid peroxidase antibodies. Get those a little bit bigger. Okay, 22 should be 0. These have to be 0. So this is why she has Hashimoto's. Either your immune system is attacking and destroying your thyroid or it's not. All right? So she has these antibodies. Her immune system is attacking her thyroid. And look, when our immune system is out of balance and the internal environment in our body is out of balance, we can develop autoimmune disease, even cancers too. Now, traditional medicine has no treatment for this. And even if this isn't a, thyroid disease, doctors are still chasing the thyroid and treating it with medication, which they did with her for a while. And she honestly stopped taking it because she didn't think it was doing anything. And I wouldn't necessarily recommend that, but she did. And there may be times when thyroid medicine is necessary. And with Hashimoto's, it often is. But because there are things that trigger the immune system to attack and eat away at the thyroid, treating with thyroid medication and treating any other symptoms won't ever solve that problem. It doesn't stop the immune system. Taking those medications doesn't stop the immune system from attacking the thyroid. The triggers must be addressed. Now, Hashimoto's can cause nodules, even thyroid cancers. So when this happens, they take it out, right? Usually surgically. Now, if we can catch the issue soon enough, getting the immune system into better balance and restore health, then we prevent all this from happening in the future as you move through life and age. So, okay, this lady, obviously her immune system was out of balance, as well as a lot of other organ dysfunction and disease, hence so many symptoms, right? And she has several illnesses, has had several illnesses, including hepatitis A, COVID, several UTIs over the past years. She'd even developed one after she had had these tests done, a urinary tract infection. She had several had several physical traumas and accidents, had a family history of diabetes and inflammatory arthritis, mental health issues, and so forth. Okay. All right. So now let's keep going and see what's going on inside and what environment created this situation in the first place. Okay. So looking at her CBC, iron first, sorry, her ferritin is high. So she's got high iron storage. This is evidence of a chronic infection that she may have been dealing with for years. All right, ferritin, iron storage, super high. Now, Her CBC with differentials shows us a few things. Her red blood cells, hemoglobin, and hematocrit are all over the optimal ranges. So these three numbers right here, RBCs, hemoglobin, hematocrit, these are over the optimal range. Really don't want this over 4.75 in the red blood cells, 4.7 or so. Hemoglobin should be less than 14.5. Hematocrit should be less than about 43 and a half. So the fact that these are elevated is part of a pattern of heavy metal toxicity. Now, neutrophils, these are white blood cells. Neutrophils, lymphocytes, monocytes, eos for eosinophils, or basophils. Neutrophils are the bacteria fighters, and so she's now, they should be less than 60. She's at 65. She has a bacterial infection, right? And she has 10% monocytes, so above 5 or 6%. This means this is an active infection. And again, I don't know how long she's been dealing with it, but she's been gaining more and more weight over the years. Had one time where she was able to, lose 30 pounds, but the diet that she used back then doesn't work anymore. And I don't remember what that was. Eosinophils are your parasite fighters. She is dealing with parasites. Ladies, we all deal with parasites. We all have them. And this is her response to them. And we need to help her get rid of those too. All right, so hidden infections. Now let's look at glucose and look and see if she has a blood sugar issue, which she most certainly does when fasting glucose is high, when it's above, even this is above the lab range, so 99. I really want it between 80 and 90, okay? Maybe 75 to 90, but we don't really want it much higher than that. And then we see her BUN is high. 27, and that's at the top of the reference range, but this should only be up to 16. Optimally, this should only be, between like 10 and 16. So this means she has dehydration in her cells. When cells don't make energy, because she doesn't, her cells are hibernating, they're resting, and they're not making water as a result. When cells don't make energy, they don't make water. So we know that her metabolism actually is slow. And the BUN to creatinine ratio also indicates that. That's high. Now, you might think that this has a lot to do with her kidney dysfunction, and it very well might, but she is in stage 2 chronic kidney disease, and she didn't know this either. Okay? So 5 stages of chronic kidney disease. There is no medicine to treat this. You have to take care of the root causes, which is get the toxins out of the body and reduce the insulin resistance, which I'll show you in a moment. So she has this chronic kidney disease, stage 2. This can be treated from a functional perspective. My own GFR was in the low 70s 15, 20 years ago, and it's now 97. Right? So it's treatable, it's reversible, right? But there is no medicine to treat this. Doctors just watch it get worse and worse. So we don't want to see that. All right, now her electrolytes. These are fairly dysfunctional. Her carbon dioxide is low, it's super low. Really should be 25 or more. 25, okay? And so because it's so low, this means that she is not absorbing as much oxygen into her cells as she needs to. This is very typical of someone with shortness of breath on exertion. And her chloride is high, also meaning she's dehydrated. And the imbalance between the sodium and potassium and the chloride and carbon dioxide is quite large. So we add these two, 147.5 minus 124 is 23.5. This is a huge anion gap, and it shouldn't be more than 12, and she's 23.5. She's got a major electric shortage happening, right? Voltage gap is what we're talking about. And this means she's going to have the brain fog. She's going to have the sluggishness. She's going to be stiff and slow to get started in the morning. And she is very, very slow and sluggish in the mornings for sure. Then once she gets going a little better, she's a little, she does okay, but still can't walk, be on her feet for long. She has to sit down a lot. So she's very sedentary. All right, this is a trigger. This, along with the higher blood sugars, will trigger her immune system to attack her thyroid. Both of these liver enzymes, AST and ALT, are above 19. I don't like these above 19. So 10 to 19 is optimal. This means that her liver cells are stressed. This means that she is dealing with inflammation in the liver. This is fatty liver, okay? The sign of fatty liver. All right, so I mentioned that she actually got a UTI after these tests were done, like a week or two later. This was what she was dealing with before, and it's showing that she's dealing with something going on in her urine with over 30 white blood cells and esterase as well. So yes, indeed, and protein. And so she was dealing with a UTI later on. This is the genetic test. Now, I'm not going to go over it on the website for sake of time, but she has the genes. She is biotoxin susceptible. That's what these mean, meaning that her body cannot get rid of biotoxins. These cause inflammation, especially mold toxins. They cause insulin resistance. They cause kidney disease. They cause immune dysfunction. They can cause autoimmunity and cancers. So it's very important that we know that she's got these genes, because if her body can't clear these toxins out on her own, she needs help to do so. All right, as far as cholesterol goes, higher triglycerides over 100, 70 to 100 is optimal, means that she does have fatty liver disease and insulin resistance. LDL cholesterol is not the problem. This is not a cause of anything if you look at the actual science. And I talked more about cholesterol in a Wellness Wednesday I did. You might look that one up. May talk about it a little bit Saturday. But cholesterol is not the cause of anything. In fact, cholesterol is a basic building block for our bodies, and we need it to repair inflammation in our cells. All right, so TSH is over 2. I don't want to see TSH over 2. It's problematic, all right? But her thyroxine looks pretty normal, and in fact, it's optimal, as is her T3 uptake, her free thyroxine index. So it doesn't look like too much of a thyroid hormone deficiency yet. She's not taking levothyroxine anymore. So we're gonna go back to this and discuss why her thyroid numbers look fairly normal so far. Second. Okay. And 5.6 for hemoglobin A1C. This is the average blood sugar over 3 months. Well, a lot of you know that this means there's a blood sugar issue. And she does, in fact, have a blood sugar issue. We're going to look deeper at some other markers too. So she has insulin resistance, and she's almost pre-diabetic. Glycomark. This is a very important test to explain why she has a blood sugar issue. When this is less than 20, this means that her blood glucose levels are variable. Her blood sugars are variable, meaning her glucose is going to peak higher. Okay. And that's going to cause more insulin release from the pancreas, and she's going to gain weight, more and more weight. Now, free T4 is very normal. However, reverse T3 is high. This means that this is blocking her T3, which is the active thyroid hormone, and she is hypothyroid as a result of this. All right, this is important. Even though her other thyroid numbers were okay, she's hypothyroid functionally because her reverse T3 is too high. And that's because of infection and stress. So we need to treat those underlying causes in order for the reverse T3 to come down. Vitamin D is okay. It could be a little better at over 70 or 80. Now, fructosamine, this is an average blood sugar marker, average blood sugar over 4 weeks' time. Okay. It should be less than 213, and she's at over 230. So she is averaging higher blood sugars for sure, promoting insulin resistance. She's super inflamed with a C-reactive protein of 8.07. And this is really high. This means she's at high risk for a sudden event. Okay, a sudden cardiac or brain event. Should be less than 1. And this is a marker that's made in the liver to tell us that she's inflamed. This indicates cardiovascular inflammation. Homocysteine is also high, should be no more than 3 to 5. And at 11.4, it's significantly high, also indicating inflammation, cardiovascular disease risk, neurodegenerative disease risk, like developing Alzheimer's, Parkinson's, ALS, and so forth, MS, things like this. And her uric acid is elevated over 4.5. This is even high enough to cause gout. And it does cause joint pain in women, most of all, just like widespread systemic joint pain, or multiple joint pain. So that's what's going on with her. She does have pain in multiple joints, and it could be this uric acid that she can't clear. This is a sign of fructose toxicity. Your body can't do anything with the fructose. It's got to store it as fat. When it won't convert it to glucose because the body's switch is flipped to that. It's flipped to converting glucose into fructose instead. All she can do is store it as fat. Okay. All right. Thyroid T3 hormone 148 is pretty good. And again, she has Hashimoto's, causing the immune system to attack. And that will often keep those levels pretty normal, but she does have high reverse T3. Now, magnesium, I wouldn't say this is actually high. Functionally, this is where it should be. We need a lot of magnesium, ladies, to keep our cells making energy and helping our thyroid work in the cells and so forth. Now, fibrinogen activity is a marker for inflammation as well. This is a clotting factor. She's at increased risk for clotting. Insulin, look at how high this is. Look at how, it should be less than 5. Okay, 2 to 5 is where fasting insulin should be. And she's at 33.9. Insulin is the fat storing hormone, and it's one of the most overlooked hormones because that causes all these problems, causes this fatigue and this poor stamina. If she's resistant to insulin and it's building up like crazy as it is in her blood, then this is going to cause inflammation also. And she's going to be tired. She's not going to have the stamina to get around more than 5 minutes without really suffering. She said she forced herself to walk through a store one day instead of use the electric cart. And she was down for 4 days. That's how bad this gets. And I know you ladies are dealing with some of these symptoms too. Maybe not quite as bad, some of you, but you're dealing with the tiredness, the exhaustion. You're dealing with the brain fog, the poor sleep. She didn't sleep well either, again, because of pain. But people will wake up when they have blood sugar dysregulation and blood sugar problems. And, you have the anxiety and depression and it's got causes. When we do these labs, blood sugar problems will cause anxiety and depression. And like I said, brain fog. Insulin resistance is the number one cause of cognitive decline and Alzheimer's disease. It's not genetics. Okay. And then her free T3 is okay at 3, but like I said, it's being blocked by reverse T3. All right. So that's the end of the blood work. And I wanted to show you this this lady's case because she's very similar to many of you. She felt awful. She has all the symptoms that a lot of you have, and yet she kept going to her doctors and they were running these labs, basic labs, not all of these, as a lot of you who, if you did bring your labs along, you could tell that you're missing a lot. And it's not unusual, to see these. I see them all the time. Okay. And, how many of you suffer from these symptoms and then you find it difficult to make plans that you can keep and make, commitments that you can, stick to. So key takeaways from tonight. Are you your own advocate? Were this lady's doctors, were they checking, her adrenals? Were they checking her inflammation markers? Her, really paying attention to her liver markers? How long has this Hashimoto's been going on? Right? She has had to take responsibility and got the right tests when she had an opportunity. So kudos to her, right? She took responsibility. The word responsibility means the ability to respond. So it means that if you're not making progress, if you still have symptoms and you're still suffering, you have to respond and you have to do something differently. Because when we don't like, the day to day, today becomes the same thing, tomorrow becomes the same thing, the next day. Look, the weeks turn into weeks that turn into months, right? That turn into years with these same issues and they worsen, right? They get worse over time. And many of you have been dealing with these symptoms for decades. So I encourage you to start becoming your own advocate, right? Like reaching out, asking for those blood tests, asking questions. If you see something as high, then you're asking those questions about, well, what's going on with this? Because things are just not just out of lab range for no reason. They truly mean something, especially if they're out of these dysfunctional ranges, right? Or optimal ranges. And I need to mention that I know the frustration that most of you have is that you have to ask for, additional testing from your doctors and you're just trying to get answers, but insurance doesn't cover it all. And it's just nuts. Okay. All right. This is the root cause model where we're looking through functional lenses. But there's a lot of things that we can do. And the data that we can gather from all of this information absolutely dictates and changes our treatment. So it's absolutely necessary to get comprehensive testing, even when insurance doesn't cover it all. And I want you to be healthy. And if you want to be healthy, you got to stay out of the sick care model. Health care is not sick care, right? Health is preventing diseases. Health is functional, being functional, not being dysfunctional, right? It's reversing disease and putting you into an optimal state of function. Okay, the other thing that I want you to take away from tonight is that I hope that you have some restored hope and that you're not going to give up hope, right? You're not going to give up because there are answers. And if you have a symptom or symptoms, there are imbalances for sure. And you just have to figure out what it is. And then that will help you figure out what the solution is. So make sure that you join me Saturday for the boot camp to learn how to fix your thyroid. You don't want to miss it. Okay. Again, it's Saturday at noon, Mountain Time, 11 Pacific Time, 1 Central, and 2 Eastern Time. 90 minutes. All the important lessons that and key breakthroughs that I shared during the masterclass, but I've condensed it. Okay. into one session. Now, I love to see so many patient, success stories. And most of them that you see in the group are our patients, and they're going through my program and they're really tackling their root causes. Some of them are not my patients, and they've only attended these classes, and they're implementing what they learned. And some of these women are losing weight and their energy is improving, and their joints are less painful, and their lives are really turning around. So one last thing. If you're new to the group and have questions at all, confused about how to attend, the event Saturday, make sure that you reach out to Juliana. She is your Facebook concierge, and if you know how to DM or direct message her, you can do that, or you can text her directly at 208-842-4466, and she will help you out. But be sure to register. The link is in the comments. And then you will get the Zoom link to be able to attend on Saturday. All right, I'll leave it there. I appreciate you attending Wellness Wednesday tonight. And again, I want you to have hope. There are answers. You still have the power to heal. And I'll see you Saturday. Have a good night, everyone.